If you had ACL reconstruction surgery, we're going to teach you how to bend your knee and get the maximal range of motion possible. So first, we're going to use a strap. You're going to go on your stomach, and when we put the strap, we're going to place it on our foot. Once we place it on our foot, we're going to have the athlete lay down on his stomach and really make sure he activates his core, gets everything neutral, and he's going to pull with his arm and try to bring that knee towards his butt. He might not get as far, but we want to make sure we get a good stretch on the top of the thigh. You're also going to feel your hip flexor stretching because we're going to really get an extension from here from the hip. This is a little different from the heel slides because our hip is now extended as opposed to when it's bent, and you're going to feel a deeper stretch. We can also do a contract relax, so where he pulls here and then he just kind of slightly puts some pressure, and then he does that for 3 seconds, then he relaxes and he pulls back a little bit more just so he can get a squeeze a little bit more range of motion out of this, and then he relaxes. So all these are just holding it for a couple seconds and doing this repetitive. Big thing that we see often is as they're bending, they'll start lifting up from the hip here because the hip is really tight, the rectus femoris. So you got to make sure that hip is down toward the table. You might not go as far, but that's okay because you're really stretching out that muscle, that quad muscle, going from that hip all the way down to the knee. And that's a big one in helping with your range of motion. So remember, grab the strap, pull it as far back towards you can, hold it for a couple seconds, then push out against it so we can create some contraction, confuse the brain, and then relax it, and then we stretch it out even more. Big thing is feel the stretch. You shouldn't feel any huge discomfort in the kneecap or anything, just a big stretch. Let us know in the comments below if you've done this stretch.